There are a lot of promising things going on, but when it comes to a vaccine, its arrival could be a year or more away. Dr. Devi Nampiaparampil joins us right now for the NYU School of Medicine. Doctor, always great having you on. If you can help us with these various treatments, vaccines, potential cures, that's what people leap on. In the best case scenario, they would still be a ways off before people could use them, right?
Well, it seems like it. I mean, some of the treatments are already underway in terms of these trials. So, for example, hydroxychloroquine, even though there have been mixed results, it's already in large trials. So we may see results from that sooner. There's some other drugs like remdesivir, which has shown promising results. So these are all good things. The vaccine may take longer because it's a little bit different. You have to make sure that it's safe, first of all, if you're administering it. And then you have to see how well it works when people get exposed to the virus again. So those things may take some time. And I think with the concern about a second wave of coronavirus, we may see that wave before we see everything else come to fruition.
Would a second wave be a mutated wave? Would it be a different type of a virus, doctor, where all these potential treatments and remedies might not work?
Well, there's always a potential for that because there are a lot of unknowns, but at least in the testing that's been done so far, they've seen that the coronavirus seems to change in part. That's how they can tell the strains that are coming from China versus from Europe versus from other areas. But the fundamental aspect of the virus seems to be the same. So if we have a vaccine or a treatment that targets that, then it should work even if it's seasonal. I mean, some of the other things that, I think about that might help us are, can we control some of our risk factors? So we know people who have multiple medical problems, people who are obese, tend to be more at risk to get the coronavirus. So if possible, if we can get those things under better control, that would be great. But I think it's hard because a lot of the elective procedures and specialists' offices are closed right now. And in terms of obesity, it's really hard to control that when your physical activity and your food options are also limited in many ways. So it's very challenging, but I think there are things we can work on.
Do you think we're ready to slowly start going back to work?
Well, it's a mixed bag because even if I think about the healthcare sector, right, I think if we look at how can we fight the coronavirus, if people start going back to medical offices, for example, to get their other medical conditions treated, that should help overall in the fight against coronavirus. But the problem is, will the patients feel safe coming in? Will employees feel safe going in? So those are challenges. I mean, we've made advances with certain things, but we still don't have a treatment for coronavirus. So people still are at risk. And as we saw with the USNS Comfort, they tried to have that ship separated for people who did not have coronavirus, but that didn't work out because it's so difficult to separate out the patients. So I can see that happening even at work and as the economy opens up. But I really want to see it open up, but I think it would be really hard to separate out who is sick from who isn't. And then once a person comes in that's sick, it's so easy for it to spread to the others.
Doctor, thank you very much. Very good catching up with you. And thank you for all your help on the front lines and all of this. Be well, be safe.